Good evening, everyone. Welcome to session 9 of the Master Trainer program. And this is the second last session. We started the discussion on 17th of June, and there we are about to close the program. So, as usual, when we move towards the end of the session, another program, I feel, oh my goodness, so soon we are going to kind of part away. We won't be meeting this regularly the way we meet every week. But of course, we can all stay in touch. I will not be dismantling the WhatsApp group. We'll keep it alive. Only thing is, we have to take care not to post any irrelevant messages in the group. But whatever professional discussion or questions we have from each other, we can always connect and speak to each other through WhatsApp. So today's topic of discussion is very interesting, and usually I used to keep it as session 4. This topic, this is facilitation skills. But this time I changed the order. I thought, let me first cover the clinical topics and then maybe the topics around how do you go about designing a program or delivering a program, we will do little later. So therefore, if you saw the topic on designing the program was something like 6th or 7th session, and this is like 9th session, and we are going to cover facilitation skills. So my question to all of you is, what is the need for facilitation skills? Why do we need to have why do we need to devote 2 hours to this particular topic? So, I had a reason on my mind, so that's why I kept this topic in the program. But I want to understand from some of you, if you would like to unmute and speak, why do you think we need to talk about facilitation skills? Anyone? If you raise your hand, that will be better because then I'll know who wants to answer.
So, ma'am, I just missed the topic name per se. So, if you can.
So, do you understand the topic? What is facilitation skill?
Yes.
Yeah.
So, how to conduct especially if you're doing a training program, how to conduct the sessions, engaging participants, and the whole idea is to ensure that whatever is the objective of the session, the learning objective get through is achieved. Basically, the people, whatever if it is about the knowledge sharing or imparting the skill part. So at the end of the day, the trainer's ability to train or skill or make them aware about the topic is completely achieved.
Absolutely. Thank you. Thank you, Dr. Santosh, for that. Okay, Suvira, I think you want to add to what Dr. Santosh said. Please go ahead. Yeah.
I very much agree with what Santosh sir has said. And to add to that, I feel the facilitator is the key person in spreading any sort of knowledge on the basis of whatever the program is. But only if the facilitator is like the correct medium to sort of translate that knowledge in a particular way, then that knowledge enables us and empowers us. Otherwise, not everybody can do a good job at it, and not then the information that is passed on may not have that kind of impact, which is why facilitation needs to be understood as an art, as a skill, as a method to the madness.
Absolutely. Thank you, Savira, for adding this aspect of the facilitation. See, I know most of you have been, in medical college, you have been teaching students, you have been working with interns and your resident. And the regular way of teaching or the traditional way of teaching has always been, kind of lecturing where you have a set of notes in your hand and this is what I want my students to learn and then go back. But incidentally, the program that you are going to deliver from now onwards, it's not going to be something with students or something who are naive, but it's going to be actually people who are very learned, experienced, knowledgeable, professional. So really to, create interest, engage them and have a fruitful session, we really need to know how do I go about making my session interesting and engaging. And we have seen people, they would come with a set of PPT or some notes. They would just talk on the dais and go back, and half the time either the speaker is sleeping or the audience is sleeping. And I know we all have seen such situations. And we have seen speakers, when the moment they come to the dais, they actually electrify the dais and the the whole audience is alert and interested and engaged and enthusiastic. So what do exactly they do? And can we learn from that? And can we, imbibe those strategies and demonstrate them in our way of, conducting training program is the agenda for this session. So considering that this is a master trainer program and you all are going to be training in some or the other capacity, so I thought that this is a relevant topic to cover for all of you because we need to come out of that mindset of using only PPTs. That's what we are used to. So how do we go about changing our strategy and applying new ways of teaching and training in the program? And it's not just for the this particular program. I think any skill building, any knowledge sharing, even when you speak in the conferences, when you speak in small groups or large groups, if you have some effective medium to communicate your message, it becomes easy for you to translate your knowledge into wisdom for them. So another agenda for this particular session is that I came across situations where I had difficulty handling a set of audience. I'm sure you also must have had some experience, when you were early on in the training, because there will be people who would be, they're sitting there, not interested, not very happy to be there. So they may disturb you, they may ask you questions, they may irritate you, they may talk to others and kind of not pay attention and not be very serious about the program. And it becomes very challenging to control or handle this situation. So if I share my personal experience, I had a program in one of the government hospitals, and there was some, RWA, Residents Doctors Association members sitting in the audience. I didn't know about that they have come with an agenda. So the moment I started talking about what is the importance and relevance of communication and why we should be, communicating effectively with the patient, they came up with their, issues that they had with the management. Of course, their issues were very genuine and they were very relevant, but probably that was not the platform to talk about them. And I was no one to answer them because I was an outside faculty, so I had no knowledge of what the reality is and what are the bottlenecks and what their challenges are. So as a result, I mean, I honestly, I was clueless. How do I really handle them? Because there were a lot of them, like 4, 5 of them. And people who are in such kind of associations, they're very vocal, they're very outspoken, they're very aggressive also in their approach. Sometimes they're very offensive also. And that was one session. Fortunately, I had few people from the management side who were very wise, and they took over the situation. They handled this situation, and they said that this is not the platform to talk about all this, but let us deal this later. But right now we are here for another purpose, and they controlled the situation, and I could kind of deliver my session. But that was an eye-opening experience for me because honestly, I had never had an opportunity like this where somebody was standing in front of me and asking me and not ready to listen to me. And then I decided that I must upskill my skills to handle even that kind of audience. That I'm going to cover with you towards the end of the session. And if you remember the questionnaire that I sent you, the Google form that I sent you was basically to help you see how disruptive behavior can upset and how do we go about handling it. We'll be doing some activity also around it and we'll have discussion about it also. So to learn how to really handle these kind of situations, I did that train the trainer program with Dale Carnegie. It was a 3 days program. Now I think it's 5 or 7 days program, and they've really made it very
And
detailed.
you did with Dr. Uday Parikh?
No, I did not attend Dr. Uday Parikh. I attended it was I'm forgetting the name, but he was one of the faculty from Dale Carnegie, and it was
Because I worked with Dr. Parikh and I was
oh
fortunate to work with him for at
wow,
least 3, 4
excellent,
years.
wonderful. I think
Yeah, he's
you
very,
must have really learned a lot of good things.
yeah, father of a child. Yeah, a lot of things he gave insight about this thing.
Absolutely. Yeah, yeah. So I in those days, I mean that program costed me something like 45,000 rupees, 3 days training. Now I think they're charging something like 75,000 or something, maybe more than that. So I whatever I learned, I tried to now put that all in my 2 hour session with all of you. I thought everybody should benefit from that learning. And with this idea, I also, included this topic in the session, that we all must be ready to handle such situations and manage a difficult audience. And there was a huge chunk of discussion on how do you manage difficult audience, and that's what I'm going to share with all of you. So this is briefly about what this topic is all about and what we are going to cover. My next question to all of you is, what is the difference between teaching and facilitation? Because both have quite similar agenda. So I want you to actually write in the chat box. That will be better, because now I want everybody to try to give their point of view. So what is the difference between teaching and facilitation? Is it same? Is it different? That's my first question. Is it same or different?
It's different.
It's
Different.
yeah, it's different. Thank you, Aarti. Yeah, I agree with you. So what is the difference? If you would just, share your thoughts on how is it different?
Again, ma'am, I think my perspective, I mean, quick thing is teaching in generally teaching, of course, teaching nowadays, of course, now it requires a lot of facilitation, but simple term, they're like resident. So they have mucked up something they just want to impart. So it's mostly, it may be measured, it may be one way kind of thing. I know
Yeah.
this, you should know this. So
Yeah, thank you.
but,
So, Dr.
but
Santosh, I'm
in,
asking everyone to write their thoughts on in the chat box, so that others can also contribute to the topic. So I can see some points coming from some of the participants. Like Aparna has written, teaching is generally one way. Yes, Aparna, I completely agree. And training is working on skills. Okay, Atid, I agree with you. Then Vimal sir says very rightly, teaching is actually uh, presenter centric, yes, because it's all about what he knows or she knows, and that's what she's going to talk about. Then teaching is one way method, and facilitating is a two-way process. Rose, I completely agree with you. Sivira says it's an umbrella term. Presentation is a medium to teach. Absolutely. Teaching is an umbrella term, and presentation is medium to. It could be presentation, it could be lecture, it could be using, some board or some audiovisual ways. But I think teaching is just that I have a set of knowledge, I believe, and I believe the audience does not know about it, and I am here to deliver some knowledge. So that's the approach. Like Vimal sir said, that it's more, presenter centric, because presenter becomes the epitome of knowledge and source of knowledge for everyone. And then Kumar sir says teaching is reading the book and facilitating is reality example. Yeah, I think you're quite close to what you're trying to say. That probably teaching is about some academic, topic that we normally deliver, whereas facilitating is about learning through experiences and also relating it with our day-to-day life and helping learn people from those learnings. And teaching is generally less interactive. Shubhra, I agree with you, because again, it's a one way, so naturally the audience is just quietly listening, and therefore there is not any real interaction. Parvi says facilitation centers on guiding a group to explore, discuss, and generate insight on their own, often leading to collaborative solution. I think, Parvi, you have really summed it up. Let me read Kausal's comment also. Teaching is content centered, expert centered, and facilitation is learner centered and enabler and more interactive. Absolutely. I think I've got wonderful points from all of you. We are quite clear about it now. I'll just sum it up in one line. Then facilitation is ensuring to take audience to the real knowledge. Yes, I think again you are very close to the difference between teaching and facilitating. Very right. Teaching is more like a passive mechanism of delivering knowledge. Teacher would be mostly talking, listeners will be either listening or nodding or maybe just noting down, but there's hardly any two-way communication. Also, if you see in the facilitation, there's always some participation. Like, for example, now we are discussing. I'm not answering the question. I'm just asking the question, and you see all of you are giving me so many answers that probably I could have never generated myself. But the kind of answers that I'm receiving from all of you, that's actually opening the a plethora of knowledge. So that's the beauty of facilitation. I think one of the basic differences, when we are dealing with adults, when we are dealing with educated clientele, when we are dealing with people who are knowledgeable and they have experience, teaching cannot work. Teaching cannot work because there is no zero in that. The audience already has some content. Can I relate with it? Can I make it experience based? Can I make it useful for them? Can I connect the dots and show them what exactly I want to say? So facilitation is a very active process, and all ideas that come from the audience are appreciated. Now, all of you are giving your ideas. That way, that is somewhere or the other touching the main point. And I'm happy that you are trying to answer, you are trying to contribute, you're trying to, give your point of view. And the learning in facilitation is through participation. So a lot of you, for some reason, when you're not able to have your camera on, it could be because of the network issue, maybe where you are, maybe you have people around you. I mean, when you're not able to have your camera on and you are not able to participate, your learning goes down. Whereas when you are actually sitting with the camera on with 100% attention on your screen, it becomes a complete two-way process, and it's more like a physical setup that we are having in the classroom. So the idea is in facilitation, learning happens through participation from both the parties, from the learner as well as the speaker. Then facilitator is not a super identity. Facilitator is part of the group. So I'm sure every time I talk with all of you, I have been able to, showcase that I don't consider myself as an authority on this subject. I just consider that maybe I'm doing this on regular basis, so I have some information that I can help you learn. But ultimately, the knowledge comes from all of you, and we all learn from each other. So facilitator is always a part of the group and does not consider himself or herself as an authority in any sense. Then the experience of the participants are really valued, because we know you're coming from varied background, you're coming from varied experiences. So when all of that comes on one platform, automatically the learning becomes very rich for all of us. So that way the facilitator basically does the job of a kind of a navigator, whereas all others participate and then contribute and talk on the same topic, brainstorm on the same topic, and then new ideas come out of that discussion. And a lot of facilitation is experiential or experience based. So we use a lot of activities, we do a lot of group discussion, lot of brainstorming, lot of case studies, then role plays. So all that is with the idea that when we look at one situation from different perspectives, we learn more rather than one person just explaining a situation. So that's the beauty of the facilitation, whereas we all know teaching is more like academic activity, and the learning objectives are very fixed. There is no scope for any illogical idea. If a student or a participant asks a silly question or gives a silly answer, they are usually ridiculed, which is actually not the right approach even in teaching. But we know that sometimes teacher would shout at them, "What silly question are you asking? Are you in your senses?" Or the teacher might say that, "Oh, this is such a useless answer. Where are you? Are you not in the class?" So that means they don't allow people to digress or they get distracted. They just want to the point question and to the point answer. And the teacher there is always separate from the learner, because they consider themselves as authority and kind of a knowledge source, because they have studied their topic, they're prepared for it, and they just come and deliver it to you. So that's the beauty of facilitation, and I think that's why I thought that we will talk about this in depth, because it's very important to learn how do I go about delivering a topic in an impactful manner. So the moment you will remove your teacher's hat and wear your facilitator hat, you will feel more comfortable and more connected with your audience. And facilitators play a very, very smart role. They have a set of knowledge because they have prepared themselves for that topic. They definitely have some skills to impart, some knowledge to give, but in a very smart way, they create an opportunity where people are more receptive to their ideas. So the facilitator actually fosters curiosity, fosters interest, and creates discussion and reflection. And then at the right point of time, they will actually suggest some information which goes deep down, because by then you have already developed such a wonderful rapport with your facilitator that you become, very receptive and open to learning. And that's how facilitation becomes not only beautiful, but an easy task to perform. So honestly, I don't enjoy teaching. If I go and work with undergraduate or postgraduate students, I find it very exhausting. Whereas when I facilitate a program, I find it very enriching because I learn a lot from my audience and there's a lot of experience. So that's the thing I really, really enjoy. And Therefore, I insist that all of us should think of how do I go about facilitating a session, not delivering a session. Because I'm sure in your own capacity in the hospital, you must be talking about so many clinical topics and quality oriented topics, and then, of course, patient safety oriented topics, and of course, now communication topic. So never think of delivering a session. Always think of how do I facilitate that. And for that, one learning that's going to greatly help us is how is adult learning different from adult? So if we understand this part, because adults, they have their own plus and minus. Do we know that? Are we aware of them? Can we use them to our advantage? And if you are able to use it, it will become very, very easy for you to work with any kind of audience, any set of audience. So let me take you through the some of my slides that I want to share with you and talk about how is adult learning different from uh, other learning. Give me 1 second to start the presentation. Okay. So this is what I was saying, that facilitators, they're very smart. They would actually create a situation where they will foster curiosity, create interest, have discussion, bring about cases, bring about situations, make people reflect, and then they will very smartly suggest some information at the right opportunity where it becomes easy for the facilitator to impart that information and knowledge with the audience. As I said, it's very helpful to understand that adult learning is different from other set of learners. And there are a couple of things that I want to discuss here. The first thing that I want to ask you about, I mean, when I talk about adult learning, it is awareness versus consciousness. So can somebody tell me what is the difference between awareness and consciousness? Somebody who has not answered. I would prefer somebody who has not tried their hands in answering this question. Even if your answer is wrong, it's okay. I don't care. But I want somebody to answer who has not tried answering. Dr. Jacob, would you like to try?
Awareness is, I guess, the topic or whatever is going on is awareness, and consciousness is much beyond awareness.
Okay. Thank you. Thank you for trying. Somebody else who would like to try? Aarti, would you like to try?
Ma'am, awareness is more about having knowledge about something. Like we usually say, are you aware about this, that we are having a workshop today? We don't say that are you conscious about this, that we are having a workshop? Like it is about having knowledge about something, and conscious means something which is related to ourselves, whether we are in the senses of that thing or not. That is
Okay. I think at least you tried to explain awareness part very well. Do you know this? Do I have the knowledge of that? Wonderful. I think that's a wonderful explanation. Anybody else who has different explanation to the same two terms who want to try answering?
Awareness is the assistance level. Consciousness would be more of mastery level.
Okay. Again, a different perspective that you have added. Thank you. Yes, Dr. Purnima, go ahead. Please unmute your device.
Good evening, ma'am. Good evening, all. I would also like to put it this way, that awareness is something that you have become aware of by absorbing the knowledge through any medium, whereas consciousness would be something which would come from within and from within your own value system too. Thank you.
Okay, I think another new perspective you added to the two terms. So how many of you have seen this board on the side of the road? And what exactly do you think it indicates?
There is a school, I think, ahead.
Yes, absolutely. Very right. So we have seen this kind of board at a lot of time, near school, that there is a school ahead. That means we are aware that there is a school ahead. But how many of us genuinely slow down to make sure that we don't hit anybody, or we don't hit any child, or we don't hurt anybody? So awareness is knowing. Consciousness is using that knowledge in your actions. So for example, we all know that we should be kind and nice to our subordinates and our staff. We have that knowledge. But how many of us genuinely practice that? So with adults, you will see anything that you talk about, they will say, I know. I have an idea. I've attended a class. I've read about it. So that means they know everything. There is nothing that they don't know. Naturally, I mean, they're very experienced. But when you talk about, are you using it? Is it really coming in your action? That's with the difference. You will see that they will be aware, but not necessarily they will be actually using that knowledge. Yes, Dr. Santosh, please go ahead.
Ma'am, I think to some level awareness is of course at the mind level, but consciousness sometimes become automatic. So I'm driving. In the beginning, we don't make so much of mistake because we are aware, we are very conscious driving slow. But when it becomes very automatic, then we commit more mistakes of all that. So that more deeper than awareness actually.
Yeah. So if you see, we know at red light we should stop. We all know. It's not just about traffic rules, it's about safety also. We all know that we should stop at the red light, whether there is another vehicle coming from the other side or not. But how many of us consciously practice this? And you will see a great difference in knowing and actually implementing that knowledge. I think the same challenge we are facing in quality, in patient safety, in errors that happen in patient care. Most of the things people already know very well. Even people, when they talk to patients, they know this is how we should be talking. But how many of them genuinely practice that in their real life situation? And you will see a huge gap between awareness and consciousness, and especially among adults. Second point, you will see difference in learning style. So, for example, if you are kind of driving or you are going to a particular place, so how do you prefer to be explained about the direction to a place? Do you prefer to be told verbally? Okay, you tell me where do I have to go? Just tell me, I think I can reach here. And the person tells you, okay, go straight from here. Then on the right hand side, leave the first red light, the second red light, and the third light right, you have to turn right. And then you are able to immediately kind of create a mental map. Second is, you say, I can't understand what you're explaining me verbally, but please draw this on a piece of paper. I'm very happy. So that person draws it for you and tells you that this is how you have to go. And you see at the drawing, and then you say, yes, now I think I can reach here. Some people say, no, you speak, I will draw. I can't understand your drawing. I need to draw myself. Of course, now it is the time for GPS. We all know. Nobody says ki draw for me or tell me. Everybody says ki GPS. Some people are happy, especially if they have a co-pilot with them. So they say, okay, you have the GPS in your hand, and you keep telling me when I have to turn right or left. And if that person says, okay, 100 meters from here, you have to turn right. So you are able to immediately comprehend that auditory message, and you are able to drive accordingly. But some people, they're very fussy. They really want to see the map themselves. So if I talk about my experience about this, my husband, he's an ophthalmologist, as I told you earlier also. He would, I'm not talking about now, I'm talking about good 20, 30 years ago when we started our practice. So every time he would visit one of his friends, new clinic, he would come home and try to explain me, Indu, he has really made a very beautiful clinic. The moment you enter, there's a very beautiful reception on the left, and then you move little further, and there's a very beautiful place, waiting area for people. And then on the right side, they have 3 chambers, one for the doctor, one for the optometrist, and then one additional chamber for a junior doctor. I mean, for me to actually visualize what he would tell was very suffocating, very frustrating. And I would say, please don't explain to me. I don't like being told verbally. At that time, probably I didn't even know about the different learning styles we all have and the way we like to connect with the world. But later on, I got to know when I studied about it and I learned about it, I'm a visual person. I can't just, depend on auditory messages. It's very frustrating for me because I can't really comprehend it completely. Even if you look at my diary, I'll always have my diary in my hand. I will keep noting the points that I want to write because that's how I like to connect with the world. But of course, now I'm trying to work on my auditory learning also, because we have to change. Even for example, for reading the book, I used to always prefer a book that I can hold in my hand. But then I realized that it becomes very cumbersome sometimes when it is night and you want to read, and you need to have the light on, and then you have somebody sleeping on your side. So it's not really good. Then I decided, okay, let me try Kindle. But that's what I'm really enjoying now. And I changed my way, but it took me a lot of time, lot of effort. So the point I want to bring in here is, in your session, there will be people who are auditory learner. There are people who will be visual learner. And there'll be people who will actually connect very well the moment you will talk to them about some emotional connection. Because we all are wired differently. If you remember, I sent you a questionnaire and I asked you to do that. So I hope you have your answers ready. What you need to do is just count the total number of A, B, and C. That's all. Count the total number of A, B, and C, and then you can write in the chat about your scores. Shubhra, your scores are very interesting. Very interesting. I like it. I'm waiting for all others to write their scores. Very, very interesting scores we are getting to see. Let everybody finish and then I will explain the interpretation. So you can write in your notebook, your A scores are your visual scores. If you look at the statements, like for example, if I look at the first question and the statement, when I'm anxious about an outcome, the first thing that happens is things begin to look different. So A is about your visual representation. B, things begin to sound different. That is your auditory representation. And C, things begin to feel different. That is emotional representation. So A is your visual representation score. B is your auditory representation score. And C is your emotional representation score. So let's see some of these scores. They're very nice, very interesting. So Shubhra, looking at your scores, I think anything that has emotional content, you connect quickly with it. That makes a lot of sense to you. Whereas if we look at Dr. Santosh Kumar's scores, A, that is visual. So you are more connected with the world, and I mean, your visual representation scores are highest. So your preference is about visual stimuli. Rose, in your case, your C is highest, that is 7. That means emotional content has more impact on you. Suvira, Your C and B scores are similar, 7. So again, you are an auditory learner, and also emotional content has a lot of connection, that builds connection with you. Dr. Manjusha, in your case, you are a visual learner, and emotional content makes a lot of impact on you. So I hope all of you are okay with the scores that you are receiving. So for me, your scores are very interesting. A is 10, B is 2, and C is 3. So that means you are a visual learner, primarily visual learner, and you connect, well when the message is given to you in the visual form. Uh, Aarti, in your case, you are an auditory learner. Do you agree with your scores?
Yes, ma'am.
Okay, great. So I'm just picking up. Dr. Purnima, C is 13 in your case, so you need to check. Oh, yes. Yeah. Okay. So that means, the emotional content has more, quick connection with you. Do you agree with your scores, Dr. Purnima? Okay, great. Uh, Dr. Matthew, even in your case, C is very high. Poonam, in your case, C is very high. Dr. Nirankar, in your case, A is high, 8. That means you are a visual learner. So you connect better with the message when it is given visually to you. And Aparna, in your case, you connect better when the message has some emotional. So see, we are just 15 or 20 of us, but we all have a different way of connecting with the world. So as a trainer, as a facilitator, I have to make sure that I cater to all my audiences. I can't just rely on visual message or on auditory message or emotional content. Suppose if you build your content around lot of emotionality, some of your participants will suddenly become very distant from the topic. So we have seen a lot of time when we talk too much about emotions, some people just don't feel comfortable being there. So they say, please, let's talk to the point. I think we are digressing from it. So adults, not only adults, actually everybody has a different learning style. But we have to keep in mind that if we are not engaging them by using the right content presented in the right form, you may lose your audience. So it's very important to remember that people have different learning style, and we must learn to engage them. Another important point that you have to remember with adults is they have already learned something. There are schematas already there in the person's, psyche. So it's very difficult to unlearn those and then learn something new. See, for a child to learn something, it's easy because they don't know anything. Whatever you teach them, they will learn quickly. But for us, the challenge is we have learned something, and that becomes part and parcel of our life, and we believe that learn. We trust that learn. We value that learn. So to unlearn and then learn something different is very, very difficult, and that's why adults, you will see, they will take a lot of time to learn something that they have already done. So how many of you still prefer paper book over ebook? Like me, like I said, that even I prefer, I still prefer the book
I
that I
like
can hold in my hand. So see, so that's because even if we know the benefits of having an ebook, you can read it on your laptop, on your phone, on your iPad or your Kindle, but then we still want to have the book in our hand and feel it and touch it, because a lot of us are kinesthetic learner also. We prefer to physically touch the thing and learn. So we take a lot of time to even unlearn something like this. So again, for example, we all are so much used to using PPT in our training pedagogy. And even if we know that it is considered outdated now, but still somehow we have still not been able to do away with PPT. So let me share an interesting mm, experience with you, that training that I talked about, the Dale Carnegie training that I attended. The name of the trainer was Ajay Kaul. Ajay Kaul was the name of the trainer. 3 days, 9 to 6, 45 participants. And everybody who had paid so heavily, they were full on, with energy and interest and questions and answer. Can you believe he did not show us even a single slide in 3 days? Whatever he did with us was all activity based, group discussion, brainstorming, group work, but no PPT. I mean, that's how now new, trainers and facilitators are doing away with PPT. He had PPT. He was referring his notes, which is perfectly all right. You can't by heart everything, for a program like 3 days program. But not even a single slide he showed us. Everything that he did with us was all through discussion, role plays, activities, and mock exercises. And that was the beauty. So it will take time for you to unlearn, even to do away with PPT. But slowly, I think more new pedagogies you will integrate with your training pedagogy. Automatically, PPT will become very limited and very less prominent in your training. Then adults like to share experience. That's another thing we have to remember. If you don't allow them to share their experience, if you don't invite them to share their experience, they will stay disengaged. Can you believe the feedback that all of you give? From the feedback that I receive from all of you and the scores that you give me, people who do not participate, who don't have their camera on, those who don't answer questions, I'm not able to invite to talk, because at times I'm not able to see you on the screen. So even I forget, because it's difficult to remember who is on the screen and who is not on the screen. I always see you scoring little less than others, because somewhere as a facilitator, I miss to connect with that particular participant who is not visible to me. So I'm not blaming you for not being visible, but I should have the list in front of me, and I should have, number one is this, number two is this. But when you are discussing, then you're not able to focus on that particular aspect, that I must make sure that Aparna answers and Kausar answers and Aarti answers. I try to keep your names in my mind and try to call you. But if you, especially in physical setup, make sure that you make people share their experience. More you will ask them to share, and everybody has experience. Everybody has experience. Tell me anybody who doesn't have an experience. And when you make them speak, they really get engaged with you. So this is one thing that you can use in your program. Make sure that you make them share the experience. And then adults take time to change. So I hope all of you write with your right hand. Anybody who writes with the left hand, so whichever is your dominant hand, write your name in your notebook using your dominant hand. Now write your name with the other hand, the one which you don't normally use. How easy or difficult was it?
That's very difficult, ma'am.
Very difficult. And what if I said, please write all your notes for the remaining session with your left hand? Will it be easy? It can't. Same way, people take time to change. So a lot of time, if you expect, okay, I have done this training, I've covered this topic, I've talked about patient safety, I've talked about medication error, and now my participant should be thorough with it. I'm sorry, that's not going to happen, because it's not easy to change. As I said earlier, we take time to unlearn and then to learn, and therefore we have to give them that much of time to, to change their way of functioning. So even when you teach them those 7 steps of washing hands, you will still see people doing the same thing. Biomedical waste, when you teach them that this is the right way of disposing biomedical waste, you will see them making errors. That's because whatever, habit they have developed, that becomes their comfort zone. It's easy to, continue doing that. To change, they have to let that habit go. They have to come out of that comfort zone and learn something new. So, how many of you have started greeting your patients on your own after the training program on regular basis? Wonderful, wonderful, excellent. And
That
how
is
many of
the- that
sorry?
is that is the respect where we can give and we can get the respect from the patients, man.
Wonderful,
Like they
wonderful.
will feel that someone is caring about them in the hospital.
Yeah.
So half of their sick, half of their illness will go off
Yeah.
their own.
Go with it. And the moment you talk to them and
Yes,
greet
ma'am.
them and make them comfortable.
They
Yes,
are very
Vimal.
happy.
Thank you. Yes. Yes, Mr. Vimal, you wanted to say something.
In Sharda Hospital, this housekeeping and security uh, team, they refer me as Namaste Sir, because I was told saying that we need to inculcate this Namaste culture in the organization. I was doing it for 3 months, and then people started responding.
Absolutely. Wonderful. I think that's a very good practice. And I know a lot of time people are not in habit of greeting even their colleagues. It's so important to kind of, to inculcate this. I think you have to start doing it, and then slowly they will realize, oh my goodness, every time he comes and does good morning, so that's not fair. I should also greet, and then they may start doing it. And then how many of us have started building rapport with our patients, mindfully, that I have to make my patient comfortable, make them feel respected, make them feel comfortable, and, open to speaking. So maybe some of you were already doing it. Some of you have started doing it now, and some of you will take time to change. Once you will see the benefit of building rapport, making your patient comfortable, having some informal chit chat with them, and when you will see it adding value and making your job easy, I'm sure you will try to implement it.
We will
Same.
also feel some happiness, man, when we build up a rapport with the patient, when
Yes.
we solve their issues, when we comes in the night and when we think about what we done for the day, that gives very happiness, man.
Absolutely.
That
I
is
think at the end of the day, personal satisfaction and professional satisfaction is what we value most.
that gives very happiness, man.
Oh.
Like in life, something we did for someone, for the
Absolutely.
patients.
Absolutely. Wonderful. Thank you for sharing that. And I
Thanks.
think that's very important aspect of doing good job, when happiness passes through you, I always say, whatever energy you give to others, it passes through you. So it first affects your vessel. This body and mind is a vessel. So when it is passing through you, it is affecting your vessel first and then affecting somebody else. If it is positive energy, it is giving you positive energy before it is giving to other person. And when you are giving negative energy, it is first harming you and then harming you. I think once we know this, we will never be bad or rude or aggressive with people, because we know more than others we are harming ourselves by doing that. Thank you for sharing your experience, Mr. Kumar. That was nice. So that's what I'm trying to say. Same way, when you will hold these sessions in your organization, I'm sure you will try now teaching your staff, front desk staff, and then security staff to be more nice and polite and courteous and forthcoming to the patients and their family members. Not necessarily that all of them will change immediately and all of them will start practicing or showing, right from day one. They will take time to change, and you will have to be patient with that. You will have to reinforce it. You will have to kind of demonstrate it. You will have to practice it in front of them, and then you will see them changing. So when we talk about adult, as I said, they take a lot of time to change. So this is an acronym that we talked about. So A is awareness versus consciousness. D is they have different learning styles. U is they unlearn slowly. L is they like to share their experience, and they take time to change. So that's adult. So if you remember this and you keep this in mind while facilitating a program, I'm sure you will be able to, handle different situations very effectively and manage them. There are some more principles of adult learning that I want to share with you, and that will again help us to facilitate our program effectively. So, for example, as we discussed, engaging the adult is very, very important. If you are not able to engage them, you will not be able to hold this session. And to engage them, you have to create a need to learn because they feel they know everything. So unless you are able to showcase them, help them see what they do not know, what they need to learn, then they will become interested. And for that, you really need to have a very clear purpose and you should be able to translate this purpose to your audience. So if they understand the purpose and the benefit, definitely they will understand the need to learn and they will be ready to learn. So if you keep this in mind, I'm sure you will remember that we have to first talk about. So every time I start a session with you, like for example, even today when we started discussion on facilitation skills, I first talked about why do we need to learn? Because when you understand why, then you are ready to learn it happily. Because if you think, oh, I'm not into training, I'm not going to do training, why the hell should I learn facilitator? I'm not a teacher, I'm an administrator, I'm a doctor, I'm a clinician. So why the hell should I learn this? But no. But if you understood that these skills are not only just for lecturing or for program, but even in conferences and group discussions, these principles will help you to engage your other participants. And make sure that the environment, the climate that you create in the training program is always friendly and informal. So you will have to be very flexible with the adult learners. You can't be rigid about time and you must have seen, I'm not saying that and that's what we should, exactly practice in India, but in the Western programs, whenever we go, they don't mind if you're sitting in the class and eating your food or you're drinking something. I mean, they say it's all right. Of course, we don't allow that much of kind of a freedom, but then we always say that you can have tea, coffee, water in
In fact, they ask you to bring your breakfast or tea, coffee inside
yeah,
and
exactly.
have that.
So basically, they want to make the environment very friendly and informal for everyone and comfortable. For example, if somebody has come late and they have not had their breakfast and they are hungry and they know the breakfast is there outside, but if they take breakfast, they'll miss the class, and if they sit in the class, they'll miss the breakfast. So why not bring the breakfast to the classroom and attend? But of course, I mean, something like this, when we think of, we remember that we have to, we are more like friends. We are like in the same at the same level, so you have to keep it very friendly and informal with your audience. And then of course, relating and acknowledging their experience, like I said earlier, makes them interested. The moment you are able to appreciate the value they add to the session, so whenever you share your experience, your learning, your practices, your cases, I mean, it's a very rich learning for all of us, and we respect that, we acknowledge that, we appreciate you sharing your ideas. So the moment you are able to do that, you will see your participants will become interested in participating. And last line that I want to say here is the trainer needs to be thorough with the subject knowledge and the training therapists. If you are somewhere not fully prepared in terms of your knowledge or your pedagogies, you will not be able to win their attention. They can immediately sense that you're half prepared. They can immediately sense that you're not thorough with your work. So please remember, with adults, you're always on the edge. You're always on the edge. You have to remember that you are dealing with people who know maybe a lot more than you. Maybe in that particular session you are facilitating, so you become the navigator for the program, but they may be having much more knowledge than you. So you really need to be very thorough with your subject knowledge to hold their attention and to hold their interest in the session. See, another concept that will help us understand adult learning, this is called concept of humda. So what is humda? You will see that whenever you tell something to your audience or participants, they will first hear you, they will listen to you, and then they will try to make an effort to understand. So it could be maybe during the discussion, they will ask you questions, they'll clarify with you. Maybe they will go back and read about it more, but they will not let this go indirectly into their schemata. They will just hear you, they will listen to you, and then they will try to understand what exactly the facilitator or the trainer is trying to say. And then they will think it over. Does it make sense? Do I relate with it? Is it really useful? Can it have some kickback, some kind of problem, some backfire, that means they will not take it as it is. They are going to think about it before they apply. So whatever sessions we are holding, I'm sure not everything you are going to apply as it is in your workplace, because it may not be suitable for your real life situation. So definitely you will try to evaluate, you will try to customize, you will try to see what can be modified, what can be customized or modified as per your requirement. And then once you are convinced with the logic, you are convinced with the knowledge, then that's the time you will digest it, and then you will try to apply in your real life situation. So again, with adults, if they don't immediately start applying, don't be upset. Don't be disturbed. If they say, okay, I'm thinking over it, I'm considering it, I will try doing it, I will try applying it, that means they will take time to do it. And be patient, don't get upset about it. Let them process it, because they need to process it before they accept and apply. And if you act patient, I'm sure you'll be able to see them making changes in their way of functioning. Now, certain guidelines that I want to share with all of you, with the idea to make your facilitation effective, so that we know how do we go about preparing for the session and making sure that the session is facilitated very, very impactfully. So, has anybody heard of this concept of 10:1? Has anybody heard the concept of 10:1?
Is it about time, ma'am? Time is...
Try, give little more explanation, please.
So if I have to give one concept at least 10 times more, I should be knowing so that I can.
Wow, quite close to the answer I was expecting. So, especially initially, when you are working on a topic, on a subject, on a session, allow almost 10 times of the preparation of the time that you have to present. For example, for an hour session, suppose if you're going to take 1 hour training, minimum 10 hours of preparation you will require, especially when you are starting from scratch. Even till date, I never deliver my session, not only without preparation, but without going through my slides. And I invariably every time change something in my slides. I want to change the order, I want to change the content, I want to add something, I want to delete something, because there's always new addition to your knowledge and understanding. And then you want to give the best to your audience. So make sure that you prepare yourself well for the presentation. Never go back with a ready-made presentation. And that's the reason when people ask me, just recently somebody emailed me and messaged me also, a very senior person. They said, ma'am, can you please share your presentation that you delivered at a couple of places? I delivered a talk at 2-3 places. So can you please share your presentation? Honestly, I have not been able to answer that, because that person is a very senior person and I don't feel like telling them no. But I would say never, believe that the same presentation you will be able to deliver in the same impactful manner. Everybody should prepare their preparation. Therefore, I never give you slides. I tell you, you have YouTube, you have all my channels open. I put all my videos there. Go through the video, whatever content you like, pick that, customize it, and prepare your own presentation. My own presentation also, I keep changing. I think the same presentation, I may have 10 versions, because when I'm interacting with 10 different audiences. For doctors, it is different. For nurses, it is different. For front desk staff, it is different. So that thoroughness in the preparation is very important to make your facilitation very, very effective. Now imagine the trainer who took our program of Train the Trainer from Dale Carnegie, 3 days training without any PPT. How much of preparation that person must have done? I'm sure must be very, very, serious preparation that he must have done. Then another thing, please remember, know far more than you will ever use. One, because sometimes your participants might ask you something, and if you are not ready with an answer, see, I don't expect you to know all the questions and all the answer, but out of say 10 questions, for 6 or 7, if I say, I'm sorry, I don't know about it, I need to read and come back, I'm sure you will lose your confidence in your trainer. But one odd question, if I don't know, and if I say, I'm sorry, I don't know about it, I will read and let you know, which is perfectly all right. Nobody will mind. They will trust you that, yes, I mean, it's not possible, humanly possible to remember everything. But definitely you should know far more than you will ever use. Because, see, the only thing that can keep the respect of your position is your knowledge and your experience. And if you lose that, then I'm sorry, you don't stand anywhere in front of your audience. So, especially when you're doing activities, please anticipate all activities are going to take longer than your plan. You may think, okay, role play 15 minutes. Sorry, no role play goes less than 30 minutes. Small activity, 10 minutes. No activity happens in 10 minutes. They may take 15 or 20 minutes. So anticipate the activities will take longer than what you planned, and therefore keep that kind of time, in your time leverage, so that you don't overshoot the program. And then another important thing, please plan for both smaller and larger than anticipated group. So you may go somewhere with the idea that I'm going to probably talk to 30 people. A lot of time I've seen the whole hall is full. There are 60, 70 people sitting in front of you. And you're surprised that you said that only 30 participants will come. They'll say, sorry, we thought that, we will have as many people as possible. So recently, Amra Hospital, Mr. Anand and Mr. Vimal, I hope you remember, you promised that you will have only 30 participants, 30, 35 participants in this session. Whereas in every session, there were 60, 70 people because they wanted everybody to go through the training. So be ready mentally to handle that. And then you will have to maybe change your activities and customize your activities. So that kind of preparation is also required. Having a backup plan is very important. Sometimes the audio may not work, the video may not work, the PPT may not work. So how do you deliver the program? So plan A, plan B, plan C, you should have them ready so that you don't all of a sudden, appear very confused and humbled that you don't know how are you going to deliver the program. So when it comes to the training format, how do you go about training? The usual way we all suggest is start from simple to complex. So, when you start the topic, start from a very simple information and then take it to complex level. So, for example, if somebody has come to learn surgery, so instead of teaching them surgery, you first teach them how do you go about suturing a clean or lacerated wound or dressing a wound. The idea is that they should learn how to start from this simple. So even the format of this program, Master Trainer program, has been planned accordingly. If you see, we started with very simple topics to start with. And then slowly we picked up difficult, complex, and advanced level topics. And that's what we kept in mind, that we'll start from simple and go on to the complex one. For the abstract topics or areas, it is good to start from concrete and then take them to abstract level. So, for example, you have to ask your team to write some SOP of communication in preoperative counseling. So it may be very, very new to them, something that they have not done. They have no idea. Even till date, when I see the standards and objective elements, in the various checklists, I know they are written very loosely, very, very, non-specific, because we just say enhanced communication or advanced communication. What exactly, and who is going to do it, and what exactly is to be done? So it's something very, very difficult. So, for example, when we say writing SOP, most of the people find it very difficult to write SOP, and therefore we have seen in most of the hospitals it is copy pasted. Somebody has written it, somebody could get a hold of one copy, and then they change the name and the hospital and everything, and then they modified a little bit and they copy pasted it. So if, for example, if you want to tell them what exactly is writing SOP, I do this activity when I talk to my audience. I say, okay, do you know how to make a cup of tea? So naturally they'll say, yes, it's something very simple. And then I say, okay, how do you make a cup of tea? So they'll give me all these steps: pick up a saucepan, pour this much of water, put it on the gas, and then let it heat, and then add whatever you have to add, and then add milk, and then boil it. I said, whatever you have told me, can you write on a piece of
रमन
paper?
चेक करना, ऋषभ उठ गया.
Raman, Poonam, you need to mute your device. Okay, I muted it. Yeah. So when they have told everything and you ask them to, can you write this on a piece of paper? So they will write on a piece of paper the same thing, whatever they have told me. I would say you have written an SOP of making a cup of tea. So same way, whatever communication you make or whatever actions you take, if you can write them down, they are nothing but SOP. So what I have done, something concrete they already know, I've taken them from there to write something abstract. Similarly, another format is known to unknown, which is quite similar to concrete to abstract. So something that they already know, something which they do every day, and from there, if you take them to unknown, for example, from washing hands to how to wash hands in 7 steps. So they already know how to wash hands. But now I want to make them practice all 7 steps of washing. And then I take them from that to the next one. So the idea is, in your training program, make sure that you don't suddenly change the context or complexity or difficulty level. And the flow should be so, well planned that it should make sense to the audience that this is related. Each topic is interlinked with the previous and the next topic. So these are different training formats. What other training formats are you using? If I may ask, if somebody wants to share their any other training format you are using? Okay. So for the hands-on, especially if you want to give them some skill, the best way is to tell them the theory, how to do that, show them how to do it, and then let them do it. That is, let them practice. So give them theory, give them demo, and practice. Whatever you want to teach them. This is another training format. This helps to give a proper structure to the training to your program. Now, talking about the basic presentation structure, we all know that every presentation has opening, then it has some message, that is the content that you want to deliver. Then you want to provide some evidence so that whatever you are saying is taken seriously and is believed. And then, of course, you close the session. These are the 4 broad, parts of the presentation that we normally make. And we need to prepare for each segment very carefully, because every segment is very important and need to be given due attention. So for example, when we talk about opening, so what different ways do you use to open your session? Write in the chat box. What different ways do you use to open your session? Story, interesting. Very nice. Facts, again, very interesting. Setting objectives, okay. Icebreaker, okay. Purpose, case scenario, problems, story, case, question, wonderful. Introduction and ice breaking, summary and question. For which summary would be probably for the previous session are you talking about? Because we have not yet covered anything. So summary of, okay, you want to give them an overview of what we are going to cover. Is that what?
Yes, an overview.
Overview, okay. Then reflective question, that's another interesting way, with some incident. Yes, incident, if you tell them, they become interested. And then of course, case scenario. Yeah, when you again, it's like a story, but it's a real story. So and nobody knows the result, the outcome, how the things are going to unfold. So naturally, they become very, very interested. Introduction and a question. Yes, also that's another way. And then asking questions. Then objectives of the program. Suvira, is that you're saying? Objective of the program, yes, okay, great. So there are many ways, and I think these are very interesting ways. Okay, start with the picture, with the video or storytelling. Again, that's interesting. This thing, greeting and self introduction. Yes, usually that's the best way to start. But we are talking about this session. How do you go about? And okay, realistic topics. Okay. So Mr. Kumar, what exactly you mean by realistic topics here?
We need to take example of when the patient comes to the hospital.
Okay. So some
Like,
real life.
giving examples like how you treat them, how you
Okay.
get into their issues.
Okay.
Like,
Great. Okay. So some basic questions that you would ask. Okay, I think I've covered everything. There's a couple of some video clips. That's also a good way to start. So there are very many good ways to start with this section. So a lot of time when participants don't seem to be interested in the program, this happens very often, especially if the program has been arranged by management and the participants have been just asked to come and attend the program, and you see them really, I mean, you can make out that they are not really very serious or they are not very interested. So I do a very interesting activity with them, and I say then that how many of you like window shopping? So naturally, some people would raise hand and they'll say, yes, yes, we like, we like. Okay, I say, okay, one of you come with me. And I will just take that person and we'll talk to the people who are sitting, on the chairs and say that these people are probably selling something. So let's go to them one by one and just check what they are selling, but we are not going to buy anything because it is window shopping. So they will go with me and we'll sometimes buy a phone, not buy, but check for a phone or a notebook or set of pen or a purse, and then different ways we will take. Then I say, okay, after we finish this window shopping and now we are going to the car, and you suddenly realize that somewhere in one of the shops you left your bag and phone when you were looking for something. And now we have to go and look for our bag and the phone. Let's go back again and try and ask which shop we have left, because we don't remember where we left our phone and our bag. So again we go, but now since we have lost our phone and uh, purse, so we are very serious, and now we are very seriously, requesting and trying to see, sir, I left my phone with you, my bag also I've left here. Can you please help me? Can you please check? Did somebody come after me? Because now you're very anxious that you have lost something. And then I tell them, when you come for a program without knowing what is the purpose of the program, you are window shopping. But when you know what you want to learn, what you want to really get from the session, that should be the way you could go into a program. So there are so many different ways. So recently I was at Chitrakoot for a session. So some of the participants were there and some had still not come in. And I didn't want to, I wanted to value the time of people who had joined on time. Because if anybody has come on time, I really respect them, coming and attending the program. So 2-3 minutes I waited, although the organizers wanted to wait for another 5-10 minutes, but I somehow felt that it would be disrespect to people who have joined on time. So I started with an interesting story with them. And I started engaging them. And by the time, like, I finished my story, there was a message in the story. I will not now start talking about that story. But then it was a value addition to their life. And meanwhile, we could get some more participants for the program, and we continued with that. So the idea I'm trying to give you here is there's so many ways to open, and you should always be very clear how you want to open your session. It has to be a very impressive opening, because like we normally say, well begun is half done. If you have been able to begin your session well, half of the job is done, because now you already have people aligned with you. You don't have to make effort to now get their attention or engage them. Now you all are moving in one direction. So you should clearly know how you're going to open this session. Even your opening dialogue, you should be thorough with. Opening activity that you're going to use to, open your session also should be very, clear and well practiced. Practice it so well. Practice it so well that it looks like a natural. It should not like that you are just acting. It should look as though you are thoroughly prepared. So make sure that your opening is very impressive and you are thoroughly prepared for it. So your opening can be something like, it could be a very startling statement. For example, if I say every year 250,000 patients die because of medical errors in US. So this is a shocking news. Nobody knew the numbers. We all know that people die because of medical errors, but we didn't know the exact number. So this comes as a shock, and suddenly people become interested. Oh, in US also so many people die. Then they become interested. Or it could be something very interesting quote by a very famous authority. For example, George Bernard Shaw said, "Single biggest problem in communication is the illusion that it has taken place." And we all know, a lot of time we think I have communicated, but communication hasn't happened. And we all have seen this happen many times. You could also start with the sharing of an incident that left you startled. So, for example, if you had some horrifying experience or some strange experience, and you start your session with that, everybody's attention will be captured. The interesting thing is, nobody knows what the incident is. They don't know how it is going to unfold. They don't know what is going to be the end. So automatically they become curious and they want to know about it. You could also use some, data in the form of some report, which could tell, like, for example, this is the NHS report on errors in 2021. So according to this report, the surgeries performed on wrong part of the body were 97. It's much less than India, I think. India is in poorer state than this. So when you start with something like this, again, people will become interested. Or maybe, like some of you had written, show them some interesting pictures. So for example, if I show you this picture and I ask you, can you figure out the number of faces in this picture? So automatically everybody will start looking at it. Oh my goodness,
Two.
I can see that old lady. Kitni hai वैसे? How many faces can you see?
Two.
Two? दो ही हैं, ज्यादा भी हैं?
At least I know about two, ma'am. One old lady and one young lady.
Any other guess?
Two.
One or two?
Two.
Two. Yeah. Old lady with this, I think she's smoking. And then this young girl looking away. Yeah. I think it's two only. Great. So suddenly everybody becomes interested. Or you could show some picture and start sharing your experience that this is where I visited and I was really surprised and happy. So the idea is, start your session in a very, very impactful. Then comes the presentation of the message. So that's where the real body of the content is, where you, whatever you want to say. For example, now we are talking about facilitation skills. So where I want to tell you what are not only what are facilitation skills, but what exactly we need to keep in mind. So when you are, even presenting the message, you have to remember, don't try to give lot of content, because content has limited value. People can get content even on Google, but try to create experiences, because experiences will have long lasting impact. And very frequently have some or the other activity or something where people become interested. When it comes to format of the presentation, limit this segment to 90 minutes. Rest of the time should be utilized for activities, for group discussion or some other role plays or something. Build activities into each segment so that people don't become slow and dull and disinterested and find it monotonous. Include visuals and hands-on opportunities and provide opportunities for repetition and reinforcement. The idea is that the format of presentation should not only capture the attention, but should have rich content to deliver to the audience or the participant. And throughout the presentation, as a facilitator, you have to project enthusiasm, confidence, and encouragement. So the moment you will become dull, your participant will also go dull. So maybe you will have to leave everything for a second, make them get up, make them do some physical activity, especially in a physical session. Make them do some funny activity, do some icebreaker, because you need to get back their attention and their participation. So to ensure participation, that everybody participates, you will have to try different ways. For example, you can actually divide the whole group into smaller groups. You could make them, sit across a table. So maybe people sitting across the table could be one group, or you could make them pair even on the same table. You could make them 3 people in one group. You could make them pair. So the idea is if you change their, group size and group style, automatically they'll be engaging with different people and they will become interested. Also, you need to vary the approach. For example, you could ask some questions which could make them think and answer. You could ask them some brainstorming questions where they really need to look for an answer and brainstorm. You could give them something to write, think, and share. Again, it's something like creative thinking, role plays, we have all tried, case studies, we have all seen. So you have to integrate different approaches to make the content interesting and engaging. Also, make sure that you use various activities like quiz, flip chart, making people read, or some demonstration or some report. Again, you have to engage all senses: auditory, visual, emotional, and kinesthetic. And then also make sure that you vary the way you recognize people's efforts. So you may say them thank you. You may ask all participants to, clap or applaud. The idea is you want to appreciate people for their participation. And this has to be actively integrated in your session. Now, talking about the third part, and that is providing evidence. Whatever you say, of course, providing evidence never happens later. It happens actually simultaneously in the presentation. But I've deliberately kept it as a separate category because we need to pay serious attention to it, especially when you are dealing with, professionals, educated people, learned people. They won't just simply trust what you are saying. But the moment you provide them the source of what you are saying, that means this has been studied and this has been reported and this has been found, automatically they will take your opinion seriously. They will trust you. They will listen to you. So, what different ways do you use to provide evidence? Write in the chat box, please. What different ways do you use to provide evidence? Yes, Suvira, maybe group brainstorming through Kahoot or similar platform. Yeah, I tried Kahoot today, but it didn't work for me. I think Aarti will try today. Aarti, we'll give you last 15 minutes. Is that okay, Aarti?
Yes, ma'am.
Okay, I'll keep those 15 minutes for you. Yeah, yeah. So I can see a lot of answers coming in. Research paper references, citations, references, yes. Then research studies, situations, where it went well and bad, yes. Articles from journals, PDFs, books, absolutely. Quote articles from journals, screenshot, surgery data, yes. Journal articles. So that means whatever is official website, that's another good way. The idea is whatever you say, it should be somewhere documented. Because once you show them some evidence, they understand that you have done your homework well. You have studied it. You have prepared yourself. You know what you are talking, and this is not that you are talking in air. Case studies, yes. These are very good ways to demonstrate what you are saying comes from some authentic source. So different forms of evidences like could be facts and figures, data, research report, exhibits, newspaper cutting, pictures taken on site. So this assessment that we went 3 days ago to Chitrakoot, I'm doing an assessment for 2 eye centers. We are establishing regional training centers for patient communication and counseling. We had an extensive checklist ready to do that, but that wasn't enough. You will not believe we have taken more than 500 pictures in the hospital of different places because if I want to say something and if I later on write in the report that this is what I saw, nobody is going to just simply accept it. But what I say and if I post a picture, nobody can refuse. So paper cutting, pictures taken on site, these are very good evidences. Demonstrations that you make people do. It could be role plays, it could be skits, it could be videos or illustration. So all these will help you create evidence. Because if I say breaking bad news is very difficult, probably people will not believe me. And if I make them do role play, immediately they understand how difficult it is to do this. So demonstration where they role play and they take part, they will get to realize that what I think said is has arisen. Then examples, personal experiences, anecdotes, analogies. So testimonials, reviews, these are all good ways to provide evidence. The idea is what you say should have some authenticity. Only then you will be trusted. Only then people will believe what you are saying. So providing evidence is a very important and essential, integral part of your presentation. And pay good attention to it. Do not go unprepared, otherwise you will be challenged in the session. So if I may share another experience here, I remember after that training that I did with Dale Carnegie, because then I learned how to handle difficult audience. This was another hospital, a government hospital, and incidentally, all the participants there were doctors. It was for purely for the doctor, and all senior doctors. So one of the very senior retired professor was sitting just next to my seat wherever I had put my laptop and everything, and the title, which I now say Importance and Relevance of Communication Skills in Healthcare, I had written Importance and Relevance of Communication in Healthcare Industry. The moment he read this, he said, you can't call healthcare as an industry. Healthcare is not an industry. Now, had I been my original self, I would have fought tooth and nail with him and proved how we can call it industry. But I had attended my program with Dale Carnegie, where I learned, pick your battles. You are not there to fight with people. You are there for a purpose, and you must, go with that. I politely said, you don't agree with this title? He said, no. Thank you, sir. Thank you so much. I think it's a wonderful advice. I will take care. And I finished my discussion with him and I started. Sorry, I know it is not exactly what we are talking about, but it just came to my mind. I thought I must share with all of you. So I learned how to handle such kind of people who can disrupt your session. Yes, Dr. Santosh, I think you want to add something.
We say in God we trust, in data we believe.
Yeah.
So a lot of time the data is what, especially from relevant citation, on that.
Wonderful. I think that's a wonderful quote. Wonderful quote. I will write it here. Provide evidence. I will use this quote. In God we trust, in letter we believe. Absolutely. So we have to use that. We know people will only trust you when you are able to give them authentic source of what was. Why not? Why not? So I'm spending so much of time on this because I know providing evidence something we normally miss, because it requires effort, it requires research, it requires finding out relevant studies to support your opinion. Know how, work on it, it will help. Then fourth step is closing, which is summarizing. Again, make sure that you summarize your session very, very impactfully. So how do you all summarize normally, or how do you close the session? Let me ask you. Write in the chat box, how do you all close your session? Normally, how do you close your session? Okay, opening house questions, that's absolutely. Carry home message, yes. Take away, yes. Take away, take home message. Quotation, that's another good way. Briefly touch upon points to remember, yes. Okay, by seeking feedback, yes, that's okay. Summarize, ask someone to summarize question 2 or 3 with Q&A, yes, that's also a good way. Inviting feedback, yes. Recalling the topic and message. Conclusion, concept as takeaway, yes. And the reflective question, which leaves the audience thinking. That's another good way. Thank you, Zubira. That was interesting. Some emotional thing for better memory. Yes, a lot of time when you leave them with some impactful message, they will remember it, and they will, like, for example, in one of the program, the message I got from the trainer was, if you fail to plan, you have planned to fail. So I could never forget this. And another message I learned, a very interesting message I got, if you think training is expensive, It was something very interesting. I don't know. I don't have it now, I think. No, if you think learning new way is boring, try ignorance. So that's an interesting quote I got. Should I repeat? Okay. Do you know something similar, Aarti?
Yes, ma'am. It is like we are having 5 P's.
Mhm.
Prior planning prevents poor performance.
Mhm. Prior.
Prior planning prevents poor performance. That is 5 P's.
Very nice. 5 P's. Absolutely. Yeah. So there are so many different ways to summarize. Dr. Santosh, you have anything to add to this? Your hand was raised, so I thought maybe you have to add something.
No, ma'am, I heard the same thing like you.
Yeah. Yeah. So it could be, in nutshell, basically whatever you have learned, if you can summarize it, ask people to tell each one of you what is your takeaway. So you will see when you have 10 or 20 people, if everybody says I learned this is something new that I'm going to, or you ask them, okay, out of all this, what are you going to apply in your, from day one? So maybe everybody will say, this is what I found very useful. I'm going to. What is the new learning for you? I know most of it was you knew already. What did you learn new? So again, you will see somebody will be able to give you, 1 point each, and that way something or the other will be definitely covered. So ask the participant to, as I said, to share at least one learning, and that will help you to cover almost everything that we have talked about. And we all know takeaway summary. We all normally show as a pointer. That also can be. So some helpful personal attributes that are required to be a good facilitator, I want to share with you. And we have to acquire this. I know nobody is ready. Nobody is always 100%, perfect. But once we are mindful of this, I'm sure we will be able to, integrate them and use them in our time to come. See, you are the navigator of the program. So you'd have to enthuse, interest, passion, commitment in the audience. And if you are not enthusiastic, I am sorry, you will not be able to take your book very far. A lot of time I see trainers come and just deliver a session without any passion and interest. I'm sorry, you will not be able to do your job very well. In this session, especially in a long-term program, even in the beginning of a session, to start with, there will be a lot of ambiguity. People will not immediately align with you. People will not give you signals that they like it, they're finding it useful, they are interested. They'll give you a blank poker-like face, and you will be confused. Are they liking it? Are they finding it interesting? Are they really, what do exactly they mean? Are they really very unhappy with my program? But let me tell you, it's just initial ambiguity. We have to learn to be patient with it. Sooner you learn, better it will be, because in most of the session you will experience this. But I have seen your sincerity, your readiness, your preparation, your commitment will slowly align people with you, and they'll become interested. They will start trusting you. If you remember, right in the beginning session one, I said, trust takes time to build, and you have to be patient. Don't expect people to trust you immediately, because you are a new person to them. You are a stranger. They don't know you. They have not seen your knowledge. They have not seen your expertise. So definitely they will not give you a green signal to start with. And usually people have the habit of judging others. And we wait for the other person to falter. That's another problem with all of us. So you have to, as a trainer, as a facilitator, you have to learn to be tolerant to this ambiguity. Trainings will take you places. Training will make you meet new people, different category of people, different places across the world. Especially with the advent of Zoom and online programs, we do get sessions and programs for other countries also. So you have to be open to new experiences and new people, because I mean, if you say this is the fixed thing I do and this is the fixed audience I'll work with, that's not going to help you. So as a facilitator, you have to be open to new experiences and new people. Even the same topic delivered to different set of people will have a different impact, different experience. So be ready for all those variation and don't get upset. And for that, you require cognitive and behavioral flexibility. Even if you send them list of items that you require, things may not work the way you anticipated. But internally, if you are flexible, लाइट है नहीं है, माइक है नहीं है, प्रेजेंटेशन काम कर रही है नहीं है, ऑडियंस आई है नहीं आई है, all these things should not disturb you. A lot of time you expect a lot of people to come in and just handful of people are there. I was taking a session for a group of doctors from Afghanistan. So when I started my session, none of them had their camera on. So I said, excuse me, I need the camera on because I need to see who is listening to me. Then one of them was kind enough to tell me, ma'am, we are not allowed to have our camera on. I said, okay, I understand. Fine. I continued my session looking at the camera and there was no participant, no audience. But that's okay. That's because if you're comfortable. So make yourself, flexible and be ready to adapt to this situation because you will come across a lot of different situations.
Ma'am, just one story
Ji.
because this is again related to Afghanistan. So I was
Ji.
conducting a training program in Afghanistan, and most of the ladies were wearing the burqa. So we did not know exactly whether it is going through their mind or not. So we many times requested that if you can do it, it is up to your will. But if you can unveil yourself, it is better. So many of them volunteered. So we could have better kind of connect of the training programs.
That's why
Very challenging.
the physical program has a different, opportunity. On an online program, what happens? You can't. I waited for a good 5-7 minutes to people to open up. But when the organizer told me, ma'am, we are not allowed to have the camera on, so please pardon us for not having it on. I accepted their reason, and that's also again, cultural awareness,
Cultural thing, yes.
cultural sensitivity. So again, India is a country of diversity, and not why only India. I think the world is full of diversity and cultural, diversity. So we all have to, as especially as trainers and facilitators, be open to it and be okay with it. A lot of time when we do activities and we have men and women in the participant group, we may do an activity where we ask them to hold hands or touch each other physically. Maybe culturally they are not used to it, and we have to respect it. We have to understand. So we have to be mindful of these, cultural practices and their inhibition, and we should respect them and also know about them. I think knowing is the first step towards respecting it. Then a lot of time, we have to remember what we are telling them or talking to them. Maybe it's not really applicable in your situation. And how do we know what they are going through? I'll take the same example of empathy and compassion for the Afghanistan doctor. So I was covering with them breaking bad news and then handling aggressive patient party. They said if we tell them the truth, we are gone. They are so aggressive in their approach that nothing doing. We can't tell them. Now, in that case, I can't insist, no, you should disclose the medical error. You should be honest with them. You should actually be telling them the truth. They say they'll break us. How can we talk about that? So we need to understand what we say may not be practically possible. A lot of time, staff are so overburdened and they have so many things to do, and expecting them to behave in a very ideal way may not actually be practically possible. So please practice empathy and compassion and try to look at situation from their point of view. So when I delivered these topics with them, they picked the very difficult topics: disclosure of medical error, breaking bad news, handling aggressive patient party, because these were the topics they wanted me to cover. So when I discussed about it, then they said, ma'am, if we tell them that the error has happened, nobody is going to listen to any excuse. One case. I can't say no. I said, okay, I understand that you are scared for your life, but there can be a situation where you cannot cover the mistake. At least there you will have to come out and tell them. Let's see how we can do that. So idea is we have to understand their situation and their circumstances. Trust and honesty is a very important virtue, I think, that we must practice not only in personal life, because of course these play a very big role, but I think as a facilitator, anywhere if you are faking and you are not truthful, it gets caught. I feel it cannot be, you know, covered, it cannot be hidden. So if what you teach, if you are not practicing, what you tell people to do, if you're not doing, sorry, what you are teaching is not going to be applied. So you are a role model. What you do, what you practice is going to be seen by them. And I think honesty is the best policy. Whatever it is, tell truly rather than hiding and then later on getting to know that you were lying. Another important quality as a facilitator is sense of humility. See, ultimately, it's a very fragile job that you are doing, because you are always on guard, you're always being judged, you're always being evaluated on certain parameters. And anywhere, if you sound egoist or you sound, full of pride, uh, you lose your position. So always remember that you're fortunate that you could do this, you could, be in that position to help people, facilitate program, train people. So any trainer, any facilitator, if I've seen them being egoist or being, aggressive or rude with their audience, it doesn't really play very well. It doesn't go well with the audience. Very important thing, sense of humor. I think as a facilitator, we need to have a great sense of humor. Care has to be taken not to laugh on anybody else. We should have the courage to laugh on our own mistakes rather than laughing on others. Never make fun of people. If at all you want to laugh, you can laugh on yourself. I've seen a lot of trainers using humor in the programs and making the program interesting and lively. But again, this requires a lot of practice and expertise in doing it. Personal awareness, a very important practice that comes slowly. We should all know what our shortcomings are, what our hot buttons are, what are our triggers, what we need to work on. It's a journey we need to keep improving. Every time after the program, sit and reflect what I did right, what I did wrong, what I said was appropriate, what I said was inappropriate, and improve your performance every time. Couple of more slides, I think just few more slides. I know we are left with just 15 more minutes. Ask open-ended questions and respond with attention and praise. When you ask open-ended questions, people become interested to answer. You'll get a lot of answers. You'll get more answers than you expect. But when they are answering, listen attentively. Therefore, I make it a point when you write in the chat box, I try to read everybody's comment, because all of you are making effort to write an answer. So I want to appreciate you. I want to acknowledge your answer. And there's always a good learning from what you all are writing. It's important to create a safe and supportive learning environment. In the program, you will see there will be people who talk less. There will be people who talk more. There will be people who will not be very comfortable talking. But as a facilitator, it is very important for us to encourage participation and engage people. Ensure psychological safety in case if any participant, although most of the people are very well behaved, but then we see people acting aggressive, but make sure that you create psychologically safe environment for all the participants to share their experience and their learning in a very easy manner. Watch for the groups nonverbal. Sometimes they are not appropriate, they are not okay. So you really need to make sure that you establish the group rules to ensure safety for all. So if you remember, we in the beginning of the program we talked about these rules, and all of us, you have been very kind to have followed those group rules that we all decided. So when you see that the group dynamics are changing, you need to keep an eye on the direction of the group. You will see people aligning with each other, going against you, going against each other. So you have to be very careful in observing all these dynamics and deciding how you want to handle it. And especially if there are subgroups formed, you have to learn to handle those subgroups effectively. And for that, we are going to talk a little bit about how do you go about handling disagreement, and also how do you manage disruptive behavior. So when it comes to handling disagreement, please remember, do not try to immediately negate by saying that you disagree with what they are saying, because that's going to, again generate resistance on the other side, and that can ensue into conflict and confrontation. Then lot of time when you ask others to give their opinion and they don't agree with the person with whom you're not agreeing, automatically it gets neutralized. So we have to learn to smartly handle the disagreement by adding correct information, but of course appreciating people's attempt to try to reply. So because people are making effort to answer your question, so we have to acknowledge and appreciate their effort. Now coming to managing disruptive behavior, we will okay, let me stop sharing. Okay, can I have everyone to have your cameras on? I know this time we had a long presentation. I had so many things to cover, and therefore I haven't seen all of you. I need to. Okay, so let's do a small activity. I want one of you to be ready to talk for 2-3 minutes on any topic of your choice. Anybody who volunteers to. Any volunteer? No volunteer? Anybody who wants to talk? अरे थक गए क्या सुनते सुनते?
Talk on what, ma'am?
Any topic of your choice. अच्छा summarize कर दो कि.
Maybe I can talk about patient safety. So
ठीक है.
since you talk about patient safety, yes.
Okay, so I will put you in the waiting room for 2 minutes and I'll then bring you back. Is that okay?
Yeah, ma'am.
Okay, give me a second to put you in the waiting room. Okay. So Dr. Santosh Kumar is going to talk about patient safety, but we have to disrupt him. We have to disturb him. So how can we disturb him? How can we disrupt his session? क्या क्या कर सकते हैं?
We can keep interrupting him.
We can keep interrupting him.
We can keep raising hands always like in the
Raising hand. We can keep
Make
asking.
the mic,
Ask questions.
make the mic during.
We can ask questions. Somebody can be on phone.
Answer phone calls, yes.
Attend a phone call. ठीक है, कर सकते हैं. Everybody ready?
this.
Okay.
Uh,
Yeah. Okay. We'll apologize him. Don't worry. Yeah, Dr. Santosh, are you ready?
Yes,
So,
ma'am.
2-3 minutes are okay?
Yes,
Okay.
ma'am.
Go ahead, please. So
I've not organized my thought, but yes, just
what
to
is the
some
topic?
some
What is
I
the
can say.
topic? What is the
So I'll
topic?
talk on the patient safety. 2 minutes.
Yes, go ahead, please. Yeah.
Okay, so how many of you have
Sir, you are not
read the
audible.
recent newspaper and then realized that
Sir, you are not
in
audible.
a newspaper that somebody.
I'm not able to understand what you are
Am
saying.
I audible now?
No, sir.
Okay, I will repeat again. So I'll be talking about
Sir,
patient
please
safety
be a bit
and
louder.
which is a global. Am I louder?
Pardon,
Okay.
sir. Please be
How
Your
am I?
louder.
Am I
voice is
clear? Everybody?
no,
Everybody?
no.
Okay.
Can't hear you.
I think
So
No,
two
this
sir,
is a
people are
technology.
speaking.
sir, we can't hear you.
Okay, is it? So please check your camera, mic, everything, and maybe we will begin because from because of the
Santosh sir.
internet, maybe you might feel this problem. So if everybody is settled, then we will start. Am I
Sir, could
audible
you please
now?
tell me the topic? What is your topic?
Yes,
No.
but let us first ensure that everybody is online, my camera is working.
Sir, good
Okay,
evening.
sir, okay.
Sir, good evening.
Good evening, madam. Good
We are
morning, ma'am.
almost the end. It's
So if
21:52.
I am
So,
okay, so
when will
I need, so at least by now it seems that everybody can hear me. So let me introduce myself and
when will
what
we
I'm
be
going to
free
talk
for
about.
dinner? There's 21:52, as I believe correctly.
Yes.
How long?
So I'll be. So let me begin. I'm Dr. Santosh. I'm going to talk about the patient safety, and this is going to be 2 minutes talk. I will just introduce the concept of patient safety.
Where are you based? In which
Dr.
city?
Nirankar, if you can mute yourself, or I will mute you. If you're talking, please mute. So
Dr. Santosh,
if yes,
I'm
ma'am.
extremely sorry.
I think no, no, I understand. I understand the what is
I'm
going
extremely
on. But yes.
sorry. These people have overplayed.
No problem.
Extremely sorry. I wanted to give you the feeling how people can disrupt yourself. And this is what I've seen lot of time. And in online,
But we
especially,
overdid.
yeah, they will switch off their video and then they will talk nonsense. They will start scribbling something on the screen, or they will start their some audio visual in between. We have seen this happening. And in the physical program, you can expect anything of this. So therefore, I thought I have to give you a taste of what people do, and you can experience something like this. And I gave you a quiz also on that, if you remember. Yes. Sorry, Dr. Purnima is also saying sorry. Yes, Dr. Santosh, please accept apology from all
No,
of us.
I could visualize that people are disturbing me, testing and all this.
Thank you. Thank you for understanding. Thank you for understanding. Yeah. So the idea is, I gave you that questionnaire with the idea that how many of us can really understand what should be the way to handle it. So first, let us talk about what are the different kind of interrupters. Let's understand broad category, and then we'll discuss that quiz. I know today it might overshoot by 10 minutes. Are you all okay, or you want me to go exactly at 10?
Okay, ma'am.
Dr. Purnima, because you said it's time to.
Ma'am, I was remembering that only.
Or because I wanted Aarti to do a quiz. So, Aarti, you had to do a Kahoot, no? So, if you all want, I can stop here. I can ask Aarti to do it, and this part we can cover the next week if everybody wants to close exactly by 10. How many of you are okay to continue beyond 10? Maybe 15 more minutes. Raise your hand. 10:15 बजे तक, 10:15 तक. कुछ लोग अभी ओके नहीं है. And how many are not okay? चलो raise करो hand. How many are not okay? How many of you want to end at 10 o'clock? ये तो बीच वाले तो अब तो मान जाओ सिर्फ शुभ्रा आप ही हो. डॉक्टर में
So I
जे
have to
अपने
put
हाथ
my
नहीं
daughter
उठाया.
to sleep.
So, ma'am, we'll request you if you can, finish by 10 by doing her thing, and if we can continue the next time.
So, okay, I think that way we are just left with 5 minutes of presentation. Presentation is over.
Yeah.
Then, Aarti, you will have to do it next time. Is that okay? Okay. So let
Sure,
me
ma'am.
go through the categories that I want to discuss quickly. Just 3-4 slides, nothing much. So when you talk about the categories of disruptions, one is low degree. So in low degree, people who usually indulge into daydreaming, or they may have negative body language. You can sense that they are not interested, they are not participating, or maybe you will see them, using phone in between. So these are all low degree interruptions which can be managed, well, and we'll talk about how do you go about managing them. You will see people entering late or leaving early, or sometimes going in and coming out. And in online programs, especially, they'll keep their camera off in spite of repeated reminder, and they will not, have the camera on. That's a low degree of disruption. Moderate degree of disruption is when people will actually verbally start, having disagreement with you, or they will show that they are distrusting what you're saying. They may actually try to get attention, to other work. They may start working on something else. Maybe they are already on computer or, on phone. They may also indulge into sidebar conversation, talking to somebody on left or right. They may start passing sarcastic comments and disturbing everybody and to you as well. These are all moderate degree of disruption. The high degree of disruption is when people start acting aggressive, when you can sense that they are becoming aggressive, rude, and disrespectful towards either you or towards other people. They may actually dramatically sometimes even exit the program saying, I'm not, ready to attend your program, and they go out. They may threaten, to you or to others, threaten to you or to others for physical harm, or they may pass some disparaging, remarks towards others or towards you. So these are high degree of disruption. These are three categories of disruption. Very quickly, let's go through the questionnaire and then we finish it off. Okay. So we received responses for the different questions. Give me 1 second to load it. Okay. So the first category is people who, arrive late. So reminding them of ground rule is a good idea. Usually if you tell them that, see, this is the time we start, but sometimes using humor also is a good way to kind of make the, situation light and not make it very serious or kind of conflicting for others. So even that's also a good option but again, humor should be used very carefully, especially if the person who's coming in is either of your rank or is lower than your rank. Probably humor can work, but if it is somebody senior to you coming in and if you use humor, it may misfire. So you have to be careful with that. Then somebody has also written, have a conversation after class to understand his or her reason. I think that also is a good idea. But a lot of time you may not get a chance to talk to them, after the class.
A lot of time
Then
we ask
people
them
who
to
are indulging.
pay for the tea or snacks.
Sorry?
A lot of time we ask the latecomers to pay for the tea or snacks.
Again, that can be done. That's again a way of making the things light. But that can be done maybe with people who are either of your rank or lower than your rank, but not with the seniors. Something like this may not go well with them. Yes, Dr. Purnima.
Quickly, I would like to say that if it's more than a one-day program, then the addressing the late coming after the session is over is a good idea so that it is not repeated the next day. Thank you.
Wonderful. Yes, wonderful. Yeah. But in one standalone session, probably, I mean, this may
let it go, maybe.
You will have to let go. Yeah. People who indulge into a lot of talking in between, I think most of you have agreed that a call on others is a good idea. When you engage others, then these people automatically becomes comfortable. Sometimes ignoring helps, but then if you ignore them, they might, still disrupt your session. Have them take your place is not a good idea. If you have them take your place, then the program is gone from your hand. And then I think call on others is a good idea. Asking others to participate will automatically help you make this person quiet. Some people who are long-winded, again, kind of reminding them of ground rule may not be possible, honestly, because when they are talking, you can't say, don't you know the rule? I can't say. But politely interrupting and taking the charge from them is a good idea. Another good, idea I can share here is the moment these people, stop for a second to take a breath, it's best to intervene at that time and say, yeah, I agree with you, but let's see what others say. So then you kind of take charge from them and you ask others to participate. One track mind, people who just stick to one point and then they, fix to that point. I think prompting group members for other idea is a good answer. That's a good one. People who are not participating, brainstorming is a good way where you ask everybody to give some idea, but never start from them. Make them talk, but after you have made others talk. That's a good idea. Sidebar conversation, two good ways is, one is stop the group discussion. So you are kind of throwing light on them. So making them conscious that, oh my goodness, everybody has stopped talking. That means, and everybody's looking at me. So they will become conscious of this. Sometimes standing next to them is also a good idea to tell them that, just your silence also will communicate that they are disturbing. Reprimand is not a good idea. And shift the focus to them and ask again, that's not going to help. I think stop the group discussion is a good way. And then standing next to them quietly also works well. People who are multitasking, taking away the distraction is not possible, especially with the adult audience. You can't say, "Aapka laptop band karke mujhe de do, aapka phone mujhe de do." You can't do that. That's not a good idea. But definitely, reminding them of ground rules can work. I would suggest as one of the way is ignore. If there's one or two people, don't pay attention to them. There are many more who are actually attending with a lot of seriousness. Shift your focus to them. But if a lot of them indulge into multitasking and they are disrupting this session, then of course you have to, take an action. Snide remarks, yes. Good answer. The correct answer or the most appropriate way will be ask them to elaborate. So usually when they pass a comment, they are baseless comments. If you ask them that what exactly you want to say by this, I want to understand. I'm sure if you have made a comment like this, there is something that you want to say. Can you explain to me? So usually when they have just passed a comment without thinking much, they get to realize that they are making a baseless remark. And then of course, when you ask what do others say, do you agree with him? Then also kind of it opens, it makes them realize that not everybody agrees with their opinion. Cell phone user, I think reminding them of the ground rule is a good way. Lot of time when they are attending call and if you stop for a second, temporarily halt the training, that also makes them conscious that because of me, the program is getting disturbed. So that's a good way. Dark cloud, get their input is a good idea. Make them speak and tell what they want to say. Maybe they have a point to, say. But if they are disturbing too much, then you will have to really, talk to them and help them see how they have to manage. And people who indulge into confrontation, it's important to be persuasive, assert, and also de-escalate this situation. But pick your battle, because if you indulge into argument and confrontation, there's a possibility that this can escalate and the whole program might go out of your hand. People who give you physical threat, seeking assistance from the management is the best way, because if you try to de-escalate the situation or resolve the issue, you never know what repercussions it might have. Best is ask the management to take charge of the situation. So I gave you this activity because I thought that these are different situations you would normally come across and you may come across during different programs. So I gave you this quiz. I know it's already 10:05. Questions we will take in the next session. Feedback form I will share in the group. And let's close the session.
Thank you and good night, ma'am.
Thank you.
ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you,
Thank you.
ma'am. Good night.
Good
Good
night.
night, everyone.
Now we can have
Thank
dinner.
you. Good night.
Dr. Poonam, we can
Thank
have
you,
dinner
ma'am.
now.
Thank you.
Thank you. Good night, ma'am.